Hi, my name is Cynthia, and I'd like to talk to you about TheraCem, a self-adhesive resin cement from BISCO. TheraCem is a dual-cured, calcium and fluoride releasing, self-adhesive luting cement used for crowns, bridges, inlays, onlays, posts, and implant-supported restorations. TheraCem is BISCO's recommended go-to self-adhesive cement for quick and easy cementation on retentive preps. TheraCem's unique benefits include its continuous calcium and fluoride release, an ability to transition from acidic pH needed for initial bonding to a preferred alkaline pH within minutes. Traditional self-adhesive cements require primers to bond directly to metal or zirconia. However, with TheraCem, there is no additional primer required because it contains the MDP monomer. TheraCem comes in a convenient auto-mix syringe for perfect mix and easy placement, is radiopaque and easily identifiable on a radiograph, and exhibits an extended gel phase, or can be flash cured for easy cleanup of excess cement. To use TheraCem, remove your temporary and clean your tooth structure. Try in and clean your restoration. Then apply TheraCem to the internal surface of your restoration and seat. Flash cure to peel excess cement and light cure for 20 to 30 seconds, or allow to self-cure. It's that quick and simple and will save you on valuable chair time. When you use TheraCem, you are getting a strong, reliable cement that is easy to use and dependable. And thanks to its powerful single-step bonding formula, cementation to zirconia is easier than ever before. Is your office Thera yet?